Hello, everyone. Welcome back to Neurospicy Nursing. Today's lecture is on pediatric neurology. It's less about the pathophys of the conditions, just to kind of give you as a forewarning, less about the pathophys of the conditions and more about immediate interventions that we need to do, because that's the most important thing when it comes to pediatric neuro, just because kids and neuro conditions, they tend to decline extraordinarily rapidly. So we need to intervene as soon as possible. So yeah, let's get on into it. Now, everything neuro is my favorite thing. I am a neuro nurse as well, so I love neuro. So yeah, just a little fun fact about me. But getting on into it, first thing, bulging fontanelles and a high-pitched cry. What does this mean? This is an early sign of increased intracranial pressure. So the first thing that we're going to do is measure their head circumference. Now, some other things to know about this. Obviously, the bulging fontanelle is indicative that pressure is starting to build up in the intracranial area. Sorry, or intracranial pressure is building up intracranially. That makes more sense. The high-pitched cry is a sign of neurologic irritability. Obviously, if they are now completely to the opposite end where it's less high-pitched cry, more they're very lethargic. That's even worse, right? Very, very bad to start seeing a super lethargic kid, not responsive, that sort of thing. The other thing that we have to make sure that we do is that we're tracking the trends for their head circumference. And that is also going to help determine with interventions, right? Because if they're having like hydrocephalus, right, it may start out small, but then progress and get bigger. So we need to have those trends so that we figure out how we're treating it. All right, Cushing's triad. This is one of the things that you're going to see now that you're learning it from now into, you know, when you get into your critical care course as well. So this is something that's going to be extremely important. Cushing's triad is a late sign of increased intracranial pressure. So you will see bradycardia, hypertension, irregular respirations. Again, late sign, there's a good chance that they will end up with a herniation. And at this point, we are notifying the provider and making sure that we are urgently, immediately, emergently preparing for an intervention. An epidural versus a subdural hematoma. So I like to remember it by if they are completely stable and then they suddenly crash, that is an epidural hematoma. Biggest differences between the two is that epidural is an arterial bleed. They have that lucid interval, which is when they're completely fine and then they suddenly crash. And again, a rapid decline of level of consciousness. A subdural hematoma is a venous bleed, so it's slow and then onset over days, sometimes even weeks. They will have irritability, they'll have gradual head enlargement, kind of going back to that first slide that we talked about, where you're measuring those head circumference trends. This is another time where you would do that. And then a slow neurological decline. All right, clear nasal drainage, super important for kids. You're checking for something called the halo sign or as well for glucose content in that nasal drainage, because if it is cerebral spinal fluid does contain glucose, and then a positive test is going to suggest a skull fracture or a dural tear. So we have to make sure that we're checking that because it can let us know whether or not they have CSF leaking. All right, Babinski reflex. If there is a Babinski reflex at 12 months, that's normal. Anything kind of past it, well, to an extent. It should go up to 24 months, the latest 36 months. Anything past that is going to be abnormal. And it is a sign of a neurological issue, right? Especially, let's say if they sustained a fall, right? And they're 4 years old. And now they have the Babinski reflex and it's been absent for 2 years. Extremely red flag for a brain or neuro issue. Okay, VP shunts. These are for like hydrocephalus, that sort of thing. If they're malfunctioning, you will see vomiting, neuroirritability. That makes sense, right? Because the increase in the intracranial pressure is going to cause that neuroirritability. Most likely, it's a shunt obstruction or a malfunction, where you kind of said it's a malfunction, but a lot of times it's obstruction. But we are going to notify the provider, and then we would anticipate some sort of imaging happening, and maybe even a procedure to unobstruct the shunt. All right, if your toddler is difficult to arouse, it's going to indicate, like I mentioned previously, a worsening neurological status. So we are notifying the provider immediately. And it is also a precursor to that Cushing's triad as well. Um, that rapid deterioration Cushing's triad, that sort of thing. All increased intracranial pressure related. Now, there is a specific type of positioning for when we have increased intracranial pressure, and they can't sit lower than 15 to 30 degrees. The higher, the better. And we also have to make sure that we keep their head midline and neutral. It's going to help promote venous drainage and as well as something called jugular vein kinking, which is just kind of like if it's in a bad position. But yeah, if you guys hear music in the background, I'm so sorry. My dad is listening to a Star Trek musical on full blast, even though I told him to lower it already. So just bear with me. The moral reflex, it's normal to see at 5 months and it's still expected. Normal window is from birth to 3 to 6 months. But again, if it's past this time, then we are worried for a neurological issue. Moral reflex is that startle reflex. Okay, a concussion with persistent symptoms. We're looking at a headache, difficulty concentrating, and it persists past 2 weeks. Best intervention is going to be complete cognitive and physical rest. So, like wearing your sunglasses, not having to go to class, that sort of thing. All right, here are my resources. And thank you guys so much. I really appreciate you guys and have a great day. I'll see you in the next one. Bye.